we will discuss the potential side effects of metformin, a medication that's often prescribed for managing type 2 diabetes, PCOS, and sometimes for weight management. While it works well for improving blood sugar control and helping with insulin sensitivity, some people may experience side effects, and it's important to understand what they are and when they might happen. One of the most common issues with metformin is gastrointestinal discomfort. This can include symptoms like diarrhea, nausea, bloating, indigestion, vomiting, or stomach pain. These types of reactions are often the reason people may stop taking the medication. The exact reason why this happens isn't fully understood, but we do know that it tends to be related to the dosage. In some cases, metformin may speed up how food moves through the intestines, which can contribute to these symptoms. People usually notice these side effects when they first start taking the medication, but they often improve after a few weeks. The risk of experiencing these gastrointestinal issues can be higher if the dose is increased too quickly or if someone is taking the immediate release form of metformin, which tends to cause more stomach upset than the extended release version. Other factors like having chronic gastritis, a Helicobacter pylori infection, or taking certain medications, such as proton pump inhibitors, that interfere with how metformin is processed can also increase the likelihood of GI symptoms. Another, more serious but less common side effect of metformin is lactic acidosis. This is a condition where lactic acid builds up in the blood, and while it's rare, it can be life-threatening. Symptoms to watch out for include feeling extremely tired or weak, muscle pain, trouble breathing, dizziness, or stomach discomfort. This side effect is more likely to happen in people who have other health problems, especially those with kidney or liver issues, or people over the age of 65. Additionally, excessive alcohol intake or severe dehydration can raise the risk of lactic acidosis while on metformin. Long-term use of metformin can also lead to vitamin B12 deficiency. This happens because metformin interferes with the absorption of this vitamin, which can cause low B12 levels over time. It's not something that happens right away, rather it develops slowly with chronic use, especially if you've been on the medication for several years. A deficiency in vitamin B12 can lead to symptoms like anemia or neuropathy, which causes numbness or tingling in the hands and feet. It's important for long-term metformin users to have their B12 levels checked periodically, especially if they start experiencing any of these symptoms. In summary, while metformin is generally safe and effective for managing conditions like diabetes and PCOS, it can cause some side effects. Gastrointestinal issues are the most common, but these often improve over time. More serious but rarer risks include lactic acidosis and vitamin B12 deficiency, both of which are more likely in people with other underlying health issues or those who take the medication long-term. Regular monitoring and gradual increase in dosage can help manage these risks.